Alright, so I've just placed needles in our model's legs. If she were a real patient, I would leave the needles in for 20 minutes. I would leave the room, come back after 10 minutes and stimulate the needles. What that means is I would kind of tweak them or twist them a little bit. And then leave and come back after another 10 minutes for a total of 20 minutes. And that would essentially constitute a treatment. Now, the choice of points is not arbitrary. What that means is if you ask 4 doctors of Chinese medicine for a list of points for any given conditions, you can get 5 different answers, and they can all be correct. So there are many paths up the mountain to treating a patient. I prefer to use the fewest number of points possible. I'm going to tweak the needle. I want you to tell me when it feels heavy or achy.
Okay.
At this point, I would leave the needles in for another 10 minutes. Okay, at the end of the treatment, I'm going to remove the needle. And as you can see, no blood. I remove the needles, I put them immediately into a disposable, how's it called? As I remove the needles, I put them directly into a sharps box or a disposable box that I send off and have the needles disposed of. So when I put the needles in, what am I doing? What am I treating? Well, let's say a patient comes with a complaint of headaches, for example. In Chinese medicine, any given complaint, such as headaches, I don't see it as your primary problem. I see headaches as a branch response to a deeper problem. So if I can determine the root cause of the problem, and I can treat that problem effectively, then the branches kind of take care of themselves. Now, there are times when I can put out fires. For example, if you walked in the door with a splitting headache, I can many times get rid of that headache within 5 seconds with acupuncture. But that doesn't get rid of the cause of the headache. To do that, I have to go to the root problem. And that's one of the wonderful differences between Western medicine and Chinese medicine. Now, Western medicine is by far the most powerful medical model on the planet. No one should dispute that. Anytime that you can give a patient a medicine, put them asleep, cut open their chest, operate on their heart, and wake them up again, that's pretty powerful. Chinese medicine is by far the most elegant model on the planet. It works much more subtly, but much more elegantly by harmonizing the patient's body. It is a very clinical, efficacious medicine. It has obvious, measurable results. So the purpose of putting in the needles is to effect a positive change within the patient's body, essentially allowing the body to balance itself without using an outside influence such as medication. There are certain points that can be used to treat specific conditions. For example, if a patient is complaining of low back pain, there are certain points that we know are very good for treating low back pain. One of these points is on the ankle. Now remember, this medicine is counterintuitive. To the Western mind, it doesn't make sense. Why would I put a needle in the ankle to treat your back? Well, the fact is, it works. So I'm going to show you that point. Although our model isn't complaining of low back pain, for the sake of this demonstration, I'll put the needle in. This is a point on the bladder channel. right here. This is point number bladder 62. And we choose this point for several reasons. One, because the bladder channel itself goes all the way up the spine to the back of the head, and it actually begins, it starts at the eye, travels over the head, over the scalp, down the back of the leg, and exits at the toe. But this particular point is very good for treating low back pain. I'm going to use a guide tube to assist in this point. There, feel it? Typically, this is one point of 2 or 3 that I would use to help relieve pain. Depending on where along the back it is, I would use points either on the hand or the back of the knee, or sometimes in the back itself. What I would tell the patient is, you might feel your back kind of opening up or relaxing. That's not uncommon. I'll leave the needles in for 20 minutes. After 10 minutes, I come in and tweak them. And then, following that, I typically do Tui Na. And usually, that's when we get the best results.